Hi everyone, today I'm going to share with you a research paper I found relating to the topic, Is punishment an effective behavior modification strategy in children? Before we begin, how exactly do we identify an effective behavior modification strategy? An effective means of discipline refers to the shaping of individuals' behavior or value to certain patterns that are generally agreed by the society and the removal of unwanted behaviors. This brings both to a focus of whether punishment can make children behave in an agreeable manner. Here, we will be looking at the effect of corporal punishment. Corporal punishment is defined as the use of physical force with the intention of causing a child pain, but not injury, for the purpose of correction or control of the children's behavior. The research I'll be focusing in this presentation is a study done by Strauss and Purcell in 2009 on the relationship between corporal punishment and the development of children's cognitive behavior. It is hypothesized that the use of corporal punishment, such as slapping a child's hand or spanking, is associated with restricted development of cognitive ability. The research was based on data for 1,510 children who were aged 2 to 4 and 5 to 9. The sample in the study was drawn from women who were first interviewed in 1979 as part of the National Longitudinal Survey of Youth, conducted by Ohio State University Center of Human Resources Research. There are two main parts of the study: the measurement of cognitive ability in children and the measurement of frequency of CP. The measurement of corporal punishment was done for one sample week in 1986 and for one sample week in 1988, using two types of data. There was data recorded by the interviewer on whether the mother spanked or hit the child during the course of the interview at both times. Mothers were asked questions such as, "Did you find it necessary to spank your child in the past week?" and about how many times, if any, have you had to spank your child in the past week? As for the measurement of cognitive ability, for both age groups 2 to 4 and 5 to 9, cognitive ability of the children was measured in both 1986 T1 and 4 years after in 1990 T2. Tests administered at T1 in 1986 were body parts recognition, memory for locations, and motor and social development. The tests administered at T2 in 1990 were the Peabody Individual Achievement Test for maths and the reading recognition. According to the cognitive test, scores that are consistent with the conventions for scoring many cognitive ability and intelligence tests were created. The score for each child was the mean of the standardized score for the cognitive assessment completed by the child. The resulting score indicates how far above or below the mean level of cognitive ability each child is relative to other children in the study of approximately the same age. The mean cognitive ability scores were approximately 100 for both 1986 and 1990. There are also other variables included in the study that can possibly affect children's cognitive ability. Maternal cognitive stimulation and emotional support, for example, is measured in the cognitive stimulation subscales include 9 items for children aged 0 to 2 and 15 items for children aged 3 to 5. Examples for cognitive stimulation items are whether the mother read to the child, whether the mother helped the child learn color, numbers, shapes, and alphabet, and how many books the child had of his or her own. The highest school score completed by the mother was also included in the analysis as the proxy for family socio-economic status and because it is known to be related to the child's cognitive ability. Other control variables included in the analysis were child's birth weight, age, ethnicity, and gender, as well as number of children of the mother in the home, mother's age at child's birth, and father living with the mother at T1. This table shows the high prevalence of CP in the sample at T1. The first row of the table shows that only 6.6% of the children with the age 2 to 4 were not hit at all in either of the 2 sample weeks. Thus, 93% of children were hit at least once in those 2 weeks. The percentage of children of the age 5 to 9 who were not hit was much greater, but 58.2% were spanked in that period. The last row of this table shows that almost half of the children of the age 2 to 4 were hit 3 or more times in those 2 weeks. Mothers of children aged 2 to 8-year-old who were spanked at T1 had an average of spanking their children 3.6 times that week. 1/3 of the mothers spanked 4 or more times, while 12.8 spanked 7 or more times that week. Table 3 gives the correlation of all the variables in this study with each other. The correlation of most interest are for the hypothesized negative correlation between CP and cognitive ability. Rows 2 and 3 of column 1 in Table 3 show the hypothesized significant negative correlations at both T1 and T2. The correlation for the children 5 to 9-year-old in the second and third column of row 1 are also negative and significant, but substantially higher. For both age groups, the lower correlation of CP with T1 cognitive ability probably occurs because of the low reliability of cognitive assessment at the younger age. The correlation in row 4 and 5 for column 2 and 3 in Table 3 shows that emotional support and cognitive ability by the mothers at T1 are correlated with more cognitive ability of the children in both age groups. The study also suggested that there is a bidirectional relationship between CP and children's cognitive ability. Low cognitive ability could lead parents to use more CP because of frustration in dealing with such children or out of disappointment and resentment. More CP then leads to further hinder of cognitive development of children. The regression coefficients in the first row of Table 4 show that each increase of J unit in the 4-category CP scale is associated with a decreased cognitive ability relative to other children of 1.3 points for children aged 2 to 4 and a decrease of 1.1 points for children aged 5 to 9. These are statistically significant but are not large decrease in cognitive ability. This does not mean that spanked children become less cognitively adequate. However, Figure 1 shows that the children whose parents did not use CP in the 2 sample weeks gained in cognitive ability compared to the children whose parents used CP. The children 2 to 4-year-old who were not hit in either week gained an average of 5.5 points, and the children 5 to 9-year-old gained an average of almost 2 points in cognitive ability. To conclude, frequent use of corporal punishment hinders the development of children's cognitive ability. Children growing up without corporal punishment have better cognitive development than those whose parents use corporal punishment. The relationship between usage of corporal punishment and low cognitive ability is bidirectional and would cause a vicious cycle. Therefore, corporal punishment is not an effective behavior modification strategy in children.